And welcome back, everybody. We're back with Dr. Lauren Stegman of Palo Verde Cancer Specialists, and we've been talking about skin cancer and their innovative way of treating it earlier in the show. But what I really want you to see is how they go about it and some of the amazing photos that you brought of some of the treatments that you've done. First of all, Dr. Stegman, let's go back just a little bit. Who is a good candidate, someone who's been diagnosed with skin cancer and the type of treatment that you provide?
So patients with non-melanoma skin cancers that are 2 centimeters or less are candidates for this treatment. And the best candidates are for people whose lesions are on their face, like the lip, eyelid, ear, nose, cosmetically sensitive areas, areas that surgery could also affect function, or on areas like the arms or legs where they're prone to injury.
Okay, so we're looking at some video of the type of treatment. When we think about radiation treatment, we think about big scary, pieces of equipment, but obviously this gentleman is getting treated on his nose. This is basically it.
Exactly, yep. You're in a room, don't have to be there by yourself because our staff is in there with you, and we just put this little device right on the surface of the skin, and it takes a minute or so to give the radiation off. You don't feel anything when you're getting it. As soon as the radiation turns off, nothing's left inside you. You're not radioactive. You can be around other people. And you said it doesn't hurt. You don't feel a thing when you're getting it.
That's crazy. You might get a little sunburn. You said a little skin irritation.
Yeah, after the last treatment or two, and for about a week after, the skin gets red and peels a little bit.
Now I want to take a look at some before and after pictures of some people who've been treated. We're going to start with an area right here. It looks like the jawline here, and we're seeing kind of the progression here, Dr. Stegman. What are we looking at?
Yeah, so you can see right before treatment started, there's a picture of the lesion with some dots around it marking where we're going to treat and how it's kind of changed over time. And then the bottom picture at the furthest one over from it is afterwards.
Okay, this one is of the ear, which can be a very, very difficult and sensitive area to treat. And some people are opting to go with your type of treatment over surgical treatment, is that right?
Absolutely, because with surgery a lot of times it can be disfiguring on the ear and the recovery can be longer, and so you can see from before and after how the skin looks at the end. Quite normal.
It's amazing. It's amazing, and I'm certain that it depends on the diagnosis. This one right here is a nose.
On the nose,
which can be. And I've seen a lot of people who've had like deep scars scraping out, where this is not necessary with this type of treatment.
No, I mean, so you can see the picture that's on the bottom right of the screen is afterwards, and everything's healed up, and you can hardly even tell there was anything there.
So you said the face is really optimal for this type of treatment, but this right here is on the shin. So you can do other body parts, is that right?
Right, pretty much anywhere in the body is accessible. And again, you can see in the top picture in the far right how afterwards the skin is kind of red and sore and irritated, but afterwards it's pretty much gone. And that little whitish color area where it's left, that over a few months afterwards goes away, and a lot of times the skin most of the time looks totally normal.
The type of skin cancers that you treat, are they preventable?
So they are, in a large part, this is caused by sun exposure. And so, in Arizona, using a big hat, staying out of the sun, using sunscreen, those are the things that can help.
I feel like you should be pointing your finger at us and telling us, you better protect your skin.
Yeah, well, we know now. We didn't always know that.
This is true. This is true. But now we have an amazing option should we be diagnosed with it. Dr. Stegman, thank you so much. Really fascinating. And Palo Verde Cancer Specialists, let me tell you where they're located. They're at 7373 North Scottsdale Road, that's Suite E100 in Scottsdale. You can call them, set up a consultation, Dr. Stegman said earlier, and see if this is a good option for you, 480-941-1211. You can also visit their website. It's pvhomed.com.